Hyrimoz injection is used to treat the symptoms and prevent the progression of moderate to severely active rheumatoid arthritis and active ankylosing spondylitis. It is used in children 4 years of age and older for juvenile idiopathic arthritis. This medicine is also used to treat psoriatic arthritis, which is a type of arthritis that causes pain and swelling in the joints alone, with patches of scaly skin on some areas of the body. Psoriatic arthritis usually occurs with a skin condition called psoriasis. Indications: Hyrimoz injection is used for rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, Crohn's disease, ulcerative colitis, plaque psoriasis, juvenile rheumatoid arthritis. How to use: subcutaneous, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, adult, 40 mg as a single dose every other week, may increase to weekly dosing when used as monotherapy. Crohn's disease, ulcerative colitis, adult, moderate to severe active disease, initially 160 mg given as for 40 mg injection in 1 day, or as to 40 mg injection for 2 consecutive days. Then 80 mg 2 weeks after the initial dose, day 15. Maintenance: after 2 weeks, day 29, 40 mg every other week, may increase to 40 mg weekly if needed. Review treatment if no response in 8 ulcerative colitis or 12 Crohn's disease weeks of therapy. Plaque psoriasis, adults, initially 80 mg. Maintenance 40 mg every other week, beginning 1 week after first dose. Injections should occur at separate sites in the thigh or abdomen. Rotate injection sites and do not give injections into areas when the skin is tender, bruised, red, or hard. Who should not take this medication? Allergic to adalimumab, latex, or any ingredients in this medication. Have a severe infection such as sepsis, tuberculosis, or an opportunistic infection. Infections that strike people with weakened immune systems. Have moderate to severe heart failure. Interactions: certain medicines should not be used at or around the time of eating food or eating certain types of food since interactions may occur. Using alcohol or tobacco with certain medicines may also cause interactions to occur. Discuss with your healthcare professionals the use of your medicine with food, alcohol, or tobacco. Side effects: injection site pain, upper respiratory tract infection, increased creatine phosphokinase, headache, rash, sinusitis, nausea, urinary tract infection, abdominal pain, flu-like syndrome, hyperlipidemia, back pain, hypercholesterolemia, hematuria, hypertension, increased alkaline phosphatase, allergic reactions, hematologic disorder, leukopenia, thrombocytopenia, pancytopenia, aplastic anemia, potentially fatal, sepsis, opportunistic infections, TB, HBV reactivation, other malignancies, e.g. leukemia, lymphoma, hepatosplenic T-cell lymphoma, hematological, neurological, and autoimmune reactions, anaphylaxis, angioneurotic edema.